Okay, I'm going to get started. It's 9:01, so we are going to get started with our 2025 benefits benchmarking. Susan Culhane with Nolte Insurance, and thanks so much for taking the time to be with us today. A little gloomy out there today, but it's going to be cool, and I heard it's going to be like 60 degrees on Monday. We can wear maybe sweaters, which would be awesome. But obviously, this is a Zoom webinar. So what a webinar means is everybody is just in listening mode. All of our participants are in listening mode. So during the presentation, if you do have a question, please put it in the Q&A. We are recording this webinar, and you will all receive a copy of this recording. And then if you put your questions in the Q&A, you will also receive all of the answers. I will be monitoring that during the presentation. Abby's going to be our presenter. And so that way, if I can answer them, great. If not, at the end of our presentation, which will probably take Abby anywhere between 30 and 40 minutes. We did book an hour, but Abby will present for about 30 or 40 minutes. There is going to be time for a Q&A at the end. So if you have really long questions, maybe wait till the end. And then we're going to go through and answer those the best that we can. Like I said, you are going to get an opportunity to watch this and have the presentation in a recording. You are also going to be able to request a personalized benchmarking for your organization, and Abby will get into that as well. We do want to let you know that you're going to get SHRM and HRCI credit for this, and so that those numbers will automatically be included in the follow-up email. But now I'm going to turn it over to Abby Arbogast, and she is going to be the presenter. She is the one who put this together, and she is our data specialist on our team. So go for it, Ab.
Awesome. Well, thank you. Thank you, Susan. And thank you to everyone who is joining us this morning. Like Susan said, my name is Abby Arbogast, and I'm going to be your presenter today. I have worked in HR and benefits for over 10 years now, and my role as the HR and benefits analyst at Nolte means that I get to focus on helping clients improve plan designs, manage costs by using data to make benefits more impactful. So very much love that. Outside of work, I'm married to my awesome husband, Isaac, and have a 10-year-old son, Cade, who keeps us very busy with school and fall sports starting up next week. I'm sure many others are in the same boat. It's a busy time of year. In my free time, I love to read. I have a garden that I love to spend time in. And I love to keep learning new things. And I share that because as an HR person to my core, I know many of you on the call today are not here just for the numbers, but you're looking for that context. And that's what I love to do. I love to take data like this and connect it to real life, whether it's through work, family, or community. And that's the lens I want to make sure we're bringing to today's conversation. So before we get into the actual numbers, I want to take a moment to just talk about the benchmark data and where we pull this data from. So this data, this year's report, our presentation, pulls from more than 45,000 employer benefit plans. That data is refreshed quarterly to ensure accuracy and relevance. So what that means is that the data you're seeing today is both current and robust. The data is compiled from multiple sources, including but not limited to direct surveys from employers, plans shared by broker partners and consultants, claims data clearinghouses, and Department of Labor filings. So all of that comes together to provide a wide lens of how benefits are structured across the country. If you joined us last year, at last year's benchmark webinar, we focused more on Michigan, just the state of Michigan. And this year, we're going to open that up to the Great Lakes region. So including Michigan, Indiana, Illinois, Wisconsin, and Ohio. So this broader data set allows us to see both national and regional shifts more clearly. And then once we get to the second half of the conversation, we're going to focus on 5 key industries on the national level, which is manufacturing, construction, government and public, healthcare, and professional business services. So we're going to go ahead and let's just get right into the data. We're going to start with medical plan design, specifically with plan prevalence. So what type of health plans are employers offering? Well, starting on the right-hand side of the screen with that Great Lakes region, in 2025, the benchmark breakdown looks like this. About 46% of plans are PPOs, 28% are high deductible health plans, 17% POS or point of sale, and then 9% are HMOs. Nationally, those numbers are very similar, 48% PPOs, 24% high deductibles, 15 POS, and 12% HMO. When we looked at last year's number, looking at Michigan specifically, PPOs were consistent at 46%. So that has not changed from last year. What we did see, though, is that HMOs are stronger in the state of Michigan, which really isn't no surprise when we review that from a state level up to a regional. But that went from 24% HMOs in the state of Michigan, and we're seeing the number at 9 now. So there is a slight difference there. So overall, PPOs remain the dominant choice, both nationally and regionally. And we continue to see that consistent year over year. All right, so I know this is a slide that I think most people are wanting to see. What is that annual cost per employee? So these numbers here represent the full cost of coverage, both employer and employee portions combined, before premium contributions are split. And these are annual numbers here. For the single coverage, again, starting with the Great Lakes region on the right side, in 2025, the benchmark data did show us a range. On the low end, we see about $7,400 per year as the annual cost per employee. The median or inline point is about $8,700. And on the high end, it's closer to $10,000 annually. For family coverage, that spread is naturally larger. On the low end, about $19,000. Median sits slightly below $24,000, and on the high end, about $28,000 annually. When we compare that to the national averages and benchmark, single coverage runs slightly higher. The national median is closer to $9,000, so a couple $100 more than what we see in our region. And family coverage is around $24,000-$25,000, so a couple $1,000 difference there. When we looked back at 2024 data, Michigan was especially competitive. Plan costs were about 18% lower than national averages overall. So that affordability edge is still present this year when we look at more of a regional, through more of a regional lens, though that gap is closing. We're seeing it more narrow than ever before. Even as costs rise across the board, it is nice to see that our region is holding a slightly favorable position, especially on that family coverage side. So that's great to see. But as we look at these numbers, that next natural question is to ask, who's paying for it, right? We see the total cost, but how is that split between employers and employees? Well, that's what we get into here. This slide shows employer and employee share of the full premium before payroll deductions, and this includes all plans. So we're not breaking that out into plan types. It includes all of them together as one benchmark. With national numbers, you can see in these graphs, the employee cost is in blue and employer is in red. And for national numbers, for the single coverage, employees are on average are paying about $1,700 for their annual premiums, and employers are picking up about $7,400. On the family side, employees are paying about $6,200 towards their annual premiums, with employers paying just over $18,000, or an 81-19% cost split there. For the singles, and then 74 employers are covering 74% of the family premiums. In the Great Lakes region, the numbers are very similar, slightly lower than national. Employers on the single side, single coverage, cover about 82%, or just about 7,100 towards the annual premiums. And on the family side, they're covering 77% of the annual premiums. So the Great Lakes is running about 1 to 3 points more generous than national averages, especially meaningful on family coverage, which we can very clearly see that affordability pressure is the highest. Comparing that back to some 2024 benchmark data, and this was for PPOs specifically, employers covered 77% single, 70% family. Now that was plan type specific, but it does show a similar pattern of relatively stronger employer support compared to national norms. So this is information, data that we want to kind of keep in mind as we move forward into more of the member cost exposure, talking about deductibles and out-of-pockets and co-pays on the next couple slides. All right, so deductibles. Before getting into the data, just a quick recap. What is a deductible? The deductible is the amount employees need to pay before insurance really starts covering for the care. And this slide breaks it down by plan type. So we're looking at high deductibles, HMOs, and PPOs for both single and family coverage. Starting with the national numbers, it's no surprise here. We see the high deductible plans. It's right there in the name. Those deductibles are higher than what you see with HMOs and PPOs. But the high deductible health plans on the national level, the benchmark is $3,700 for single, and then $6,500 for family. HMOs, we see that come down, about $1,700 deductibles for single coverage, $2,800 for family. And PPOs slightly higher than our HMOs, just shy of $2,000 on the single coverage and about $4,200 for family. Now, comparing that to the Great Lakes region, the deductibles are actually slightly higher. So high deductibles plans, $3,733 for single coverage and $6,589 for family. HMOs, just shy of $1,900 for single deductibles and about $3,200 for family deductibles. PPOs, just a little over about $2,100 for single deductibles and then $4,400 for family deductibles. So these numbers are great to see, right? But what does it mean? And what does it mean for each one of you? Well, if your plan sits above these numbers that you're seeing here on the slide, that means that your employees are facing more first dollar exposure before coinsurance kicks in. If you're at or below these numbers, you're comparatively more protective on those predictable routine care expenses. So knowing the deductibles, that's fantastic. And it's an awesome setup for that next layer of financial exposure for employees, which is the out-of-pocket maximums. Now, out-of-pocket maximums represent the most financial exposures employees could face in a given year. In 2025, the benchmark report shows us that the out-of-pocket maximums in the Great Lakes region range from about 4,400 to 4,900 for singles, and about 8,800 to just shy of 10,000 on the family side, family out-of-pocket maximums, with those high deductible health plans trending higher than both HMOs and PPOs. Again, no surprise there. And as you can see, nationally, those averages are very similar. When we're looking at single out-of-pockets, we see about 4,300 to 49, or just shy of 5,000. And those family out-of-pockets, about 8,600, again, just shy about 10,000. Now, when we took a step back and we looked at 2024 data again, just to kind of see where trends are, in Michigan, the most common out of pocket was 7,350. So we can see that that ceiling has crept up slightly, meaning that affordability, of course, continues to be a challenge, and that risk exposure for our employees is continuing to go up. Turning to copays. So which are the most, copays are typically the most visible out-of-pocket costs employees face when they are using care. And this slide shows national averages, and we are looking at 3 different plan types: HMOs, PPOs, and POS plans. We took out the high deductibles because we know with high deductibles, you pay that deductible and then a co-insurance kicks in. You're not necessarily paying those co-pays. And we looked at these for both physician visits and prescriptions under a 4-tier structure. So for office visits in 2025 benchmark, we see that primary care copays range from about $24 up to $30, depending on what plan type you have. POS being that lowest cost and HMOs having that highest cost when we're looking at primary care or PCP. Specialist visits, we see that switch. So we see that HMOs actually are on the low side, and then POS is leading on the high side. But those copays range from about $37 to $47. Looking at prescription drugs, on the right-hand side there, tier 1, those are the generics. We saw a benchmark copay of $12 or 22% coinsurance. Tier 2, those are going to be our preferred brands, $36 benchmark for a copay or 27% coinsurance. Tier 3, non-preferred brand, $65 or 35% coinsurance. And then our Tier 4, those specialty drugs, we see a benchmark copay of $128 or 33% coinsurance. So next, we're going to move into some ancillary benchmarking. So with dental, dental remains pretty consistent year over year. We don't see much changes in plan design, and specifically offer rates or utilization. Those remain very strong year over year. So in 2025, we see about 92% of employers offer a dental plan. And on average, 74% of employees enroll in that plan if it is offered to them. So those are high utilization numbers. When it comes to orthodontia coverage, the numbers are slightly lower. About 36% of employers cover both adults and children, but I will say that number is continuing to tick up. Adult ortho offer is becoming more popular, while 44% of plans are covering for children only. Premiums and contributions show that most employers, about 64%, split the cost with employees. About 26% of those plans are completely employer paid, where 10% have the employee paying 100% of that cost. Now, on average, those premiums are low, much lower than what we see on the medical side. It works out to be about $34 per year for single coverage and $122 per year for family coverage. Plan design continues to be very consistent. These don't change much. They've been the same year over year for a while now. Single deductible about $50 and $150 for a family deductible with a annual maximum benchmark of $1,500. Now that $1,500 that has changed. We've seen that kind of start to tick up a little bit. But we see the benchmark for the most recent data set at $1,500. And when we look at coinsurance, this breakdown has not changed either. Pretty consistent, 100% for preventative, 80% for basic, and 50% for both major services and ortho. So again, looking back at previous years, dental does remain a stable expected benefit. Employers aren't making any type of big changes in design, but with high offer rates and solid enrollment, it does continue to be a core part of the benefits package. All right, so vision, similar to dental, vision offer rates remain stable in this year's benchmark report. 88% of employers offer a vision plan, and on average, 74% of employees enroll in the vision plan. When we look at specifically contacts coverage, I thought this was interesting. 80% of plans offer contacts coverage in lieu of frames. 18% offer it in addition to frames. So a little bit of a difference there when it comes to contact coverage. Now, premiums and contributions show that more employers shift the cost burden to employees for vision than dental. About 41% of vision plans are 100% employee paid. But I did find it interesting. We saw on the last page, 10%, we saw 10% of dental plans are employer paid, and we see that number go up here on vision. So 17% of vision plans are 100% employer paid, but we're talking about very low cost premiums, about $8 a year for single coverage and about $22 a year for family. Again, similar to dental, vision plan design continues to be very consistent year over year. We're looking at about a $10 copay for exams and $25 copay for materials. And most plans are offering exams and lenses on a 12-month basis. 97% compared to 1% for exams, 91 to 77% for lenses. But frames have more of an even split between a 12 and 24-month frequency. So employees continue to value vision benefits. They're low cost for employers, so they tend to stay very consistent year over year. Looking at some other ancillary benefits, now this graph here shows the percent offered on a national level. And nationally, the vast majority of employers continue to offer short-term, long-term disability, life insurance, both group and voluntary life, accident, and critical illness. But we are starting to see some emerging offerings on ancillary lines, things like student loan assistance, adoption assistance, IVF, and long-term care. The adoption rates, you can see they are still pretty low. Some in the single digits or close to the single digits. But year over year growth in these ancillary benefits show that employers are still considering expanding their definition of benefits to be more inclusive and supportive of their employees. All right. So as I mentioned at the beginning of our conversation today, we are going to get into industry-specific benchmarking. Now, these industries, it's national industry benchmarking numbers, and we're going to focus on these 5 here. So manufacturing, construction, government and public, healthcare, and professional business services. So focusing on medical plan design, when we look at plan prevalence, it's not much of a difference than what we saw nationally and regionally. So the benchmark data shows us that PPOs and high deductibles still dominate across all 5 sectors. As we saw again, both nationally and regionally. So in the about 40% range for PPOs, into the mid to high 20% range for high deductibles. In 2024, when we looked at our Michigan data, PPOs also led when we looked at it by industry, followed by high deductibles and then HMO. So consistency here shows that plan structure is holding steady across the board, whether we're looking at national, regional, or industry numbers. Looking at more of a cost share breakdown by industry. So looking at how premium contributions are split, this slide shows, again, national data, and it highlights some important differences in generosity by sector. So the last page, plan prevalence, everything seemed to be kind of in line. This is where we start to see some differences here. And what the charts are showing us is that the government and public sector employers tend to be more generous, picking up the largest share of both single and family premiums. Employees in this sector are contributing the least towards their medical plans. Healthcare and professional business services fall somewhere in the middle, 81 to 19% cost share on the single side and a 71-29% cost share for family. Construction and manufacturing, while competitive with their single coverage, not too drastic of a difference. It's when we look at that family coverage specifically in that construction industry where the shift the shift of costs is more on the employees. So the takeaway here when it comes to how you're splitting out who's paying for what, your industry does matter. If you are in government or public work, your employees are typically, or your competitors are giving your employees more of a comparatively stronger deal. If you're in manufacturing or in constructions, the data shows us that employees are picking up more of that cost. And that can, those things can impact affordability and retention, recruitment efforts. So it is something to keep top of mind. Looking at our deductibles by industry, this slide breaks it out by the 3 different plans again. So PPO, high deductibles, and HMO plans for both single and family coverage. The big picture, so no surprise, again, high deductibles are going to consistently carry the highest deductibles across every industry. Most single plans are well over 3,000, and family plans are typically in that $6,000 range for those high deductible health plans. Now, calling out specifically, again, government and public sector employers, they stand out again as being the most generous, with PPO and POS deductibles the lowest of all industries, around $1,300 for single and under $3,000 for families. When we look at construction and healthcare, those two tend to be on the higher side, with family PPO deductibles closer to 5,000 and high deductibles topping 6,400. And manufacturing and professional services, when we're looking at deductibles, kind of fall somewhere in the middle there. So while plan type is the biggest driver, of course, when we're talking about deductibles, your industry does still play a role in determining how much employees are asked to spend before those benefits or those core insurances start to kick in. Okay. Moving from deductibles to our out-of-pocket max, the absolute ceiling on what an employee might pay in a given year. The big picture here is a lot of consistency across both these 5 industries. Family out-of-pocket maximums are pretty high everywhere, typically falling between 9,000 and 11,000, regardless of the plan type. So that's a significant financial exposure for employees. Single coverage out-of-pocket maximums are lower, in the $4,500 to $5,500 range, but that is still substantial for most workers. Government and public sectors, I feel like I keep saying the same thing, but they stand out as the most generous, keeping their out-of-pocket limits below most other industries. And with construction and healthcare trending the highest, with family high deductibles hitting the upper end of the $11,000 range. So key takeaway here is that while employers are contributing generously to premiums and it probably maybe keeping deductibles lower, employees are still carrying a significant financial risk if they have a bad or catastrophic health year when we see out-of-pocket maximum numbers. All right, so that kind of wraps up the data part of the presentation. A lot of information, so hopefully you guys were able to digest it all. But like Susan said, we will be following up we will have a follow-up email that will be sent out to you guys. So don't feel like you have to memorize all of these things. You will have that handy. But as you can see, you also have the ability to request your own custom support. So these numbers here, they're very helpful, but they only go so far. And we understand that the real power comes from comparing your specific plans to these benchmarks. And that's where these custom reports come in. So we can take your organization's information and overlay it with benchmarks that you've seen today. And we will break that down by your industry, region, and employer side to help give you a clear, tailored view of how your benefits stack up and where you may want to adjust. And going into a pretty heavy renewal season, open enrollment, most plan years are starting January 1. This is the time you want to be looking at these numbers. So if you can make any slight changes or make any adjustments, you can have that backed by data instead of just kind of picking and choosing, oh, maybe we should raise our deductible this year. Have that data help support those choices. And the good news is you will have an easy way to request it. It is going to be in our follow-up email, so you don't have to go hunt down how to request this report. It will be right there in your inbox. All right, so we'll go ahead and open it up for questions from the Q&A.
And a couple people asked, I just had a couple so far, but please put your questions in the Q&A. We already talked about this, but you are going to get this presentation, so that's awesome. You didn't have to take a lot of notes. Then someone just asked, how much does a custom report cost? And there is no cost to this. So Abby has this down to a science. And like she had said, the important thing is comparing your data to your peers. And so she's able to do that in your industry. She picked, the 5 industries that are the most popular, but she can also narrow it down even more so for you if you would like that. And So please, if we have not done this for you already, we are happy to do it. Abby does a great job. And Abby, thank you so much for this valuable information. You did a fantastic job. So if you have a question, please put it in the Q&A. All right, I will give it a few more seconds here. And if I wish we could talk to people. I'm a talker. People knows I like to talk to people, but you can't do it on these webinars. But and obviously, you know, we know you. And if we don't know you, we would love to get to know you. Our emails, you know, just go out on our website if you don't have them, and you can also send us any type of email or text message, and we would be happy to talk to you about that too. So I think we're good. So watch for the follow-up. You will get that, I believe, today. Usually Adam's very good about getting this out to all those who participated. So watch for the email. If you do not get it, make sure you look for it in your spam. Sometimes they get caught up in there, but you can always let us know if you don't get it. So everybody have a great rest of your day. And thanks again for joining our benchmarking webinar. Take care. Thanks, Abby.
Thank you, everyone. Yeah.